So welcome to today's sonography info session. So our goal here is to get you sort of acquainted with our program and the ins and outs of Camosun and our application process. So today joining me, my name is Dustin Pendergast. I'm one of the program leaders. We have Matthew Barbas, who is also a program leader in sonography, and we'll do a proper introduction shortly. And we also have Mary Hendrickson from admissions. She would be the person who will be helping you with your prerequisites and things like that. So at some point, we'll turn it over to her, and then she'll do some introduction to her segment of the slideshow today. So let us move on. So the first thing we're going to do is start with our territorial acknowledgement. So Camosun College is located on the traditional territories of the Lekwungen and Wasanich speaking peoples. We're very fortunate to be able to work and to live and play on their traditional lands. And our school is a very beautiful school that we're very fortunate to be able to have our brand new program in the brand new building. And we'll go over that as well as we get a little bit further into our PowerPoint today. Just want to acknowledge COVID-19. Things have changed a little bit because of COVID-19. It may not affect anybody who is coming into the next iteration of our program, which will be for May of 2022. Yeah, that's the right year, isn't it? So we just want to let you know that we are taking steps for COVID-19 and for your student safety and protection and all of that. So here is our agenda for today. We're going to start with introductions next. Then we're going to go over ultrasound sonography program overview, like what the program is all about, the different student services at Camosun that are available to you, financial aid, admission and application requirements, and that section Mary will be speaking to. We'll go over the estimated program costs. Then we'll do some questions and answers, and then what you need to do next to do your application. So first things first, who are we? So Linnell is our chair of our program, and I'm the program leader of general ultrasound. My name is Dustin Pendergast. I've been doing ultrasound related 14 years. I've previously worked at Island Health. I was a manager for medical imaging. Prior to that, I was a leader for ultrasound for Island Health and a supervisor and a tech as well. So I've done lots of ultrasound. I've also done x-ray. So prior to ultrasound, I did x-ray. So I graduated from BCIT with both of my diplomas. And we are setting up the new program here at Camosun. Bridget is one of our instructors you will meet in first year, and Jana as well. I'll turn it over to Matthew because he's on the line here.
Sure. Hey, everyone. Thanks for joining us this afternoon. My name is Matthew Barbas. I'm the program lead for the cardiac part of the ultrasound program. So I'm from originally Hamilton, Ontario. I came to Victoria, BC now it's 7 years ago. So first, my education is in kinesiology at McMaster University. Having completed my kinesiology degree, I accomplished the cardiac ultrasound diploma through Mohawk College. I had a second placement out here in Victoria, BC, and never looked back. So I've been in sonography for 7 years, and the Camosun College instructor position came up, so I grabbed it right away just because I have a passion to teach and I love everything cardiac ultrasound. Yeah, that's it.
Great, thanks, Matt. So what I'll do is I'll turn it over to Mary next. We're going to skip right to Mary's section on the admission requirements to getting into our program. So Mary, we'll toss it over to you.
Great, thanks, Dustin. Hi, everyone. I recognize a couple names from this morning's radiography session as well, I think. So you're really hitting all the info today. Hi, Sharon. Okay, so actually the admission requirements are the same for radiography and sonography in terms of these academic admission requirements. So that's helpful if you're interested in both programs. So we're looking for English 12, B or higher, pre-calc math 12, B or higher, physics 12, B or higher, biology 12, which is now anatomy and physiology 12, B or higher, and medical terminology B or higher. And that medical terminology is the only one here on the list that is definitely a post-secondary course. The other courses we could be looking at high school courses, or if you have a relevant post-secondary course that could be used instead. So for example, first year English from post-secondary instead of the English 12 from high school would work. Key to note here, the academic courses must be completed within the last 5 years. So that does trip some people up because, of course, you may have completed high school more than 5 years ago now. And that it may help to use your post-secondary transcript as well as your high school transcript to meet admission requirements. Of course, some people do have to go back and upgrade because it's simply been over that time or they didn't get that grade or higher in those academic courses. And you can definitely do that at Camosun. So on the admission requirements on the website for the program, you'll see Camosun requirements listed there. So that's the Camosun alternative courses to the high school options. You're also welcome to go back and use the high school system, like we have South Island Distance Education, or SIDES, offering online high school courses in Victoria. And there's usually an option in every community where you are to do that. And we'll move ahead to the next page. So important dates. Always good to note. And we are looking ahead here already to the May 2022 intake. I got to get used to saying that now. We've been talking about 2021 coming for so long. So this May 21 will open up the applications for the May 22 intake. And then you have until August 20th, 21 at noon to apply for that intake. So throughout the summer, that's when the applications are open. Now we want to see all of your transcripts at that initial document deadline, September 17th, 21. And hopefully you will have final grades in all of the academic admission requirements that we can use in the GPA calculations. So those 5 courses that we listed as the requirements, those are used in the GPA calculation and go towards the ranking for competitive entry for the program. If you haven't completed them at that time, that September 17th date, you can potentially use the fall to complete requirements as well, but they'll go into the ranking mix as if you just had the minimum B at that point. So that is an option. And then there's that final date of January 14th when any in-progress requirements have to be submitted. The final grade and official transcript of those has to be submitted at that point. May 2nd, 2022, program starts. That'll be the second intake starting at Camosun. An exciting time. Let's go ahead to the next slide.
There's just a question from Tanner in the sidebar.
Someone had a question along the way. Yeah, if using a post-secondary degree for admission, are there specific courses that need to be done with that previous degree? Absolutely. So I would be looking for a course that matches or exceeds the high school requirement. It's like I gave the example of first year English instead of English 12 from high school. Instead of the high school biology 12 or anatomy physiology 12 as they call it now, I would hopefully be looking for an anatomy and physiology or just anatomy first year from post-secondary. Physics, it could be a general first year course, and math, it would have to be something that meets or exceeds the pre-calc math 12. So there are some post-secondary math courses that you only need, say, math 11 to get in, like say first year stats. I would not be able to use first year stats instead of pre-calc 12. But if you took, say, like a math 12 alternative at your post-secondary, or if you took first year calculus in post-secondary, that would be something that meets or exceeds pre-calc 12. I hope that helps to answer that question. Okay, so moving through the admission process. So, okay, good. Thanks, Tanner. Qualified students are ranked. So that's everybody who's met the minimum academic admission requirements. So we use those requirements to calculate your GPA. And that's actually going to be half of your overall ranking. So the other 50%, the other half of your ranking, comes from the CASPer test. That's their non-academic assessment that we're using. So we get into that test a little bit more later on. And then we have 16 spots in the program each year. So initially the top 16 students would receive an invitation into the program, asked to pay that $175 deposit to hold your seat. Deposit goes towards the first semester's tuition. It is non-refundable if you do have to withdraw or change your mind. So there is a little note to add there that you know, people do withdraw and change their minds, or something comes up in their life where it's not a good fit for them anymore. So we do usually invite people in from the standby list. So we would have here we are right here. We would have a short wait list or standby list for late entry into the program in the same year. And we do usually have to invite people in from that list because something happens within those first 16 top of the list applicants usually. Now, if you don't get a seat offer by the time the program starts, you would need to reapply again the next year in order to be eligible again to be ranked against the new batch of applicants for the new program. And that non-academic assessment or CASPer test would have to be taken again in each application year. However, one thing you can do with the CASPer is it only needs to be taken once per year for the Allied Health and Technology programs at Camosun. So right now, the CASPer is just needed for radiography and for sonography. So if you had been asked to take it, you would be asked to take it in the fall, typically October, November period, after that initial document deadline in September. And if you then applied in fall to radiography as well, we could use that same CASPer result. So at least you can use it for two things in 1 year. Okay. So we're just going over the admission requirements again. Required for your online application by January 14th. Actually, I would look for these by the initial document deadline in September, typically. So that's that you read and acknowledge the physical requirements form on the website, attend an information session. So check that off. You're doing that today, but there is the online survey to do afterwards. So that survey is how I actually get your name to confirm that you were at the information session. Now, 40 hours volunteer work, typically we would talk about that a lot more. Right now, the requirement has been waived due to the COVID-19 pandemic. So you're meeting that requirement as well right now when you sign that physical requirements acknowledgement. So there's a little bit of info in there just to address the fact that, you know, we can't really expect you to get volunteer work in a healthcare environment right now. Now, was there a question that popped up here? A zoology from 2010. And yes, you would need to take those requirements again because they are 11 years old now, and we're looking for something taken within the past 5 years. So if you're applying in the May to August 21 period for our next intake, May 22, I'm going to be looking for something completed May 2016 or later. So it's 5 years back from the point that you can apply for that intake. So try to give you the most time. It's not when the intake starts, it's when the application period starts. So that gives you the largest possible 5 years that we can. Okay, so moving on through the process here. So the academic requirements have been assessed. You've met the minimum qualifications there. You're going to receive some instructions from us for taking that CASPer non-academic assessment. So that CASPer test is what we call a situational judgment test. So they give you situations to respond to. And there's a little bit more detail coming up about it as well. There's a fee associated, so you're paying that right to that assessment provider when you register with them. We're basically just directing you to the website and getting you to choose the right test dates that are assigned for the Camosun applicants. Take it one time per application year. Do so in the timeline indicated by the program. And yes, you can use it for the other health and technologies, allied health and technologies programs. So that's radiography. Okay, carrying on. And here's the further info about the CASPer non-academic assessment. So these are the kind of skills that they are assessing with the CASPer test, as opposed to the academic skills that we're looking for when we're looking for you to have pre-calc 12 and English 12 and anatomy and that kind of thing. So they are looking for these things like collaboration, communication, empathy. So I'll put up the website after to the group chat, but it's basically takecasper.com. Is their website, and there's a very good description there of what it is like to take that test, what are the requirements in terms of like having a computer connected to the internet, microphone, camera, etc. Dustin's put up the website, perfect. So you definitely can head there to find more information about taking the test. One thing I've noted from what other people have told me is because you have 5 minutes to respond to your scenario, make sure you have some decent typing skills going into the test, because you don't want to be slowed down in getting out your thoughts and your answer because you're typing very slowly. You want to be able to get your thoughts down and answer the question. And we're into the participation requirements. That happens after, or those are needed to be completed after you have a seat in the program if you're able to be offered a seat. So I think I'll pass it back to Dustin.
Yeah, so for these requirements, you're going to need to do a criminal record check. It's important that you get the criminal record check link and email from us and then go and do it. Don't do it on your own. There's a specific, it's all linked in the system, so you need to do it via us. So don't go do it on your own because it'll be have to be redone. Every year, students will have to get mass fit testing done. You'll be responsible for completing this process prior to your first clinical experience and for any of the associated costs. The mass fit testing, I believe, is $40. Matt, correct me if I'm wrong if you know, but it's not very much, and it's usually good for 1 to 2 years. You must have and be current in your standard first aid and CPR level C prior to your first practicum. So in the sonography program, although we start in May, our first practicum isn't until September. So you actually have quite some time to get those under your belt. And as always, you'll be responsible for those costs. Other requirements, students must provide evidence that you do not have active TB. So that means you need to have a TB skin test or a negative chest x-ray, and it must be within 6 months of clinical start. So don't rush out and get it too soon. Your clinical starts in September, so you want to make sure that you're not doing it the year before. Students are responsible for the cost of that testing. Now, if you are exposed to TB or have become in contact with someone or travel to an area that has TB, you may be responsible for getting another test. Having previously had a negative test in the past, like say greater than 6 months prior to your clinical start, does not automatically exclude you from having to have the test redone. Immunizations. You must provide evidence of your immunizations or immunity to preventable communicable diseases. This does not mean that you have to have had the vaccination. It just means that we need to know which ones you do have on record. And the rationale for that is, should there be some outbreak, you at the health authority and you don't have your vaccinations, we need to know which ones you do and don't have. So it's highly recommended that you have all your vaccinations as a healthcare worker, because if in any event where they may decide to bar people from the hospital, which happened years ago with SARS. They said if you did not have your flu shot, you could not be on site at that time. If that was to happen and you didn't have your flu shot, for example, you would have to stay home, and that would put your clinical and your program at risk, and it could cause you a delay. So as always, we recommend your getting your flu shot. Estimated program costs, tuition. These are all estimates, and they do go up and down every year. Tuition goes up 2%. So tuition will be $36,461 plus 2% since this slide was made. Student fees, we estimate about $1,700. Application fee is about $43. Textbooks, we're quoting about $3,000 for the life of the program. Computer, if you already have a laptop, you know, that expense won't matter. It's highly recommended you have a laptop. In fact, we do have some tools that would require you to have one. Expendable supplies, paper binders, pens, photocopying, you know, we've estimated this much. It's, again, an overestimate. Uniforms and shoes, you will not be spending $1,560 on uniforms unless you want one for every day of the week. Exams are expensive. They happen at the very end of the program, so your Sonography Canada certification exams. So you would need to spend about $1,000 to do those exams. Program requirements, so that is like your first aid, your CPR, criminal record check, TB, mask fitting, all of that is about $400. Now, what's important to note is that grand total does not include the elective tuitions, and we'll go over what is required for electives, but because we don't know what courses you have already that may count as electives, or what courses you plan to take, we can't estimate the cost at this time for that. So the way we look at it is cost of schooling. It works out to about $98 a day or $13 an hour to attend this program. So it's really important for you all to consider showing up every day. And if you decide, I'm not going to come to school today, it's probably costing you $98 to make that decision. So we want you to attend well, not unwell. But if there's any sort of, you're not sure if you want to come just because you're not feeling it, I would highly recommend coming. There's a lot of content that gets covered. So just so you know, that's your cost. Now, when you graduate, you will go to about $32 an hour, which is more than double your investment in just 2 years. So that's a huge turnaround. And you go from, you're paying $13 an hour to making 32. So that's going to be a huge plus when you do graduate. We have really low student to instructor lab ratios. We have smaller cohort sizes. We only have 16 students. That means typically in a lab environment, you're in pairs. So that means when you're scanning and practicing on our ultrasound equipment, you're actually doing it at a ratio of 50%. You get to spend 50% of the time scanning, and that's something that I've never experienced in my career. So I will go back to the beginning. Does anyone have any other last questions for Mary before we let Mary go?
I see there's a question about the medical terminology in the chat here. So you're going to VIU, there's a medical terminology course I can take there. Yes, it's OSME 002 or something from VIU, and we do accept the VIU medical terminology course. So it doesn't have to be Camosun's course. If anybody else is looking at courses and wondering, definitely email me. I'll put my email in the chat for everyone to have as well. And I have a list that I usually send out as general information as well if anybody's sending me any other inquiries about the program, just so that you have the ones I already know I'll accept.
All right, that's it for Mary. I guess we'll let Mary go. She pasted her contact info there in the chat window, so you can email her if you need any help. So thank you, Mary.
Yeah, no problem. Thanks, everyone. Take
Thanks,
care.
Mary.
So we'll go back to the beginning here, and we're going to start with the actual program overview. So what is our program actually about? You've heard how to get into it. Now we're going to get into the meat and potatoes here. So we are located in this brand new building. This is the Alex and Joe Campbell Center for Health and Wellness, and that is located on the interurban campus. Every single health program except for dental is actually located in that building. So we're all working there together. And that allows us to have an interdisciplinary approach to the teaching and the learning. Not to mention it is a 21st century building. So it is full of technology and really cool learning aids and things like 4 projectors in each room so that no matter which way you're facing, you can see what the instructor is projecting. There's high technology simulation environments, and we'll go into that a little bit when we get into the sonography program itself here. This is Cynthia. She's our Dean of Health and Human Services, and if you go onto the Camosun website, you can actually look into it and see our student handbook, and the student handbook is available, and it goes over all the things that are minor that you may not, well, that won't be covered, sorry, here in this presentation. Things like what happens if I get pregnant? What are the rules in the labs? Things like that. So there's lots more information, and it's specific to each program, and you can have a look there. I should also mention that if you go online where you would have found the link to this meeting, there's a PDF version, and it will have, of this presentation, it'll have clickable links so that you'll be able to navigate to there. So what is ultrasound? Hopefully if you made it this far, you have some idea of what that is. Basically, ultrasound is pictures that are produced using sound waves, and it's much the same way that a bat would use sound for echolocation, or a Navy ship would use sonar to find other Navy ships in the water. Essentially what we're doing is we have a transducer with crystals in them, and we excite them with electricity. They vibrate from that electricity, and they send out these sound waves. And these sound waves, as they transfer through the tissue of the body, bouncing off the objects of interest and coming back, we listen to those sound waves with the same crystals. So the crystals will vibrate when the sound waves return to them and then send an electrical impulse back. That gets plotted on the screen as a dot, and that is done through the entire image in rapid succession. Basically, the longer time it takes for that echo to return to the transducer tells us how far away something is, and the intensity with which it is reflected back tells us how dense that structure is. You know, in ultrasound, it's the use of and the science of producing images using sound waves. We use those images to help physicians diagnose and treat disease and injury. Sonographers, which is what we're called in the healthcare profession, we produce images that a radiologist or a cardiologist interprets to aid in diagnosing a patient. And it can be used on any part of the body, not just babies. I'm not going to get into every little bit of the role of the sonographer, but you can see here, you know, we prepare the exam rooms, we have to work independently, we need to be confidential in our discussions and handling patient data and things like that. Some of the things that we do deal with, though, that people may not know and wouldn't necessarily be implied by knowing that, you know, someone's a healthcare professional. Well, most people know that, yeah, they got to keep data private, and, oh, you're an ultrasound tech, you probably take pictures. But these are some of the other things that it's important that you guys understand that you will encounter in a career with us. You know, you'll be participating and involved with things like miscarriages, fetal abnormalities, fetal demise, pregnancy terminations or abortions. We work with a lot of cancer patients. You'll be taught and given some skills in how to assist patients with toileting or if they're vomiting, or how to handle an IV. We often image patients that are critically ill in various ICUs in the buildings. We do things that we call interventional procedures. So those are things like biopsies, drainages, like removing fluid, pus, things like that from the body, abscess drainages, joint injections. So we'll put needles right into the joint and put contrast agents in or steroids to help an inflamed joint. Matt will get into this shortly. Matt is our cardiac guy here, expert, and he will talk about pericardial drainages and transesophageal ultrasounds, where we're actually putting probes down people's throats.
Well, we're not, but the doctor is. But you would.
Well, the doctor is.
Yes.
Yeah. Yeah, so we'll get into a little bit more detail here. So this is basically what it looks like to be doing a general ultrasound. So here we have a technologist sitting at the ultrasound unit. The rooms are typically darker than this, quite a bit darker than this. This is obviously taken in a bright room for the photo. And these are sample images. So here we have a fetus. I'll turn my cursor on here. We have a fetus here. Over here, this is an older ultrasound image, but it's showing a liver, bit of the kidney, right kidney coming into view, and a benign hemangioma in the liver. Up top here, this is an internal ultrasound or an endovaginal ultrasound. So we have a probe that's long and skinny, finger-like, and it goes in the vagina a short ways. And what that does is it allows us to look at the uterus up close. So this is the uterus here, and this is the endometrial lining that's shed with the menstrual period. And our next slide, I'll turn over to Matt for the cardiac portion here.
Yeah, sure. Thanks, Dustin. So here we have a sonographer scanning a patient using cardiac ultrasound. It's mostly the best way to scan patients is left-handed. It's just ergonomically the correct way to scan hearts. Let me get the cursor here. There we are. The bottom left picture, Dustin was talking about fluid around the heart. So with cardiac ultrasound, we can assess how much fluid is around the heart within the pericardium. If there's too much fluid in the pericardial layer, that could be very detrimental for the patient. The heart would not be able to relax and contract as well, and that needs to be drained. So as a sonographer, you would help the cardiologist and with the team, with the nurses, drain that fluid, providing the images. Over here in the top right, we have the apical four-chamber view. This is the money shot of the heart, so we can see all four chambers. What the cardiologist wants to look at is how well the ventricles contract, how big are the atria, and then in the bottom right picture, we have the apical four-chamber view with color Doppler. So with color Doppler, we can assess if there's any valvular regurgitation, if there's any turbulence of blood. The colors don't represent whether or not the blood is oxygenated. They represent the direction of flow. So red is coming towards the transducer, blue is going away. So with this shot right here, we can see that there is a little bit of blue coming backwards, and that represents mitral regurgitation. So we can really assess every valve and chamber with multiple views of the heart.
And this slide here is showing vascular imaging. So vascular imaging is anything that involves the blood vessels in the body. So here we can see that they're actually doing what we call sort of specialized testing. So this tech here has got multiple blood pressure cuffs on the gentleman's legs, and what they're doing is they're taking sequential blood pressures, and if they detect a drop off in the flow or in the pressure of the blood in those arteries, they can tell whether the arteries are stiffened or blocked. And we do that for lots of people who have difficulty walking, the pain in their legs, diabetic patients, people with gangrene on their feet, things like that, and we need to assess amputation levels and all that. So you will learn how to do that as well in our program. In this picture here, we have someone standing, and what they're doing here is they're assessing the veins of the leg. This would be done for varicose veins. Again, we'll look to see which way the blood is flowing, whether it's or if it's not flowing in the case of varicose veins. And that'll help them determine treatment. Do we strip the veins? Do we just inject sclerosant or tie them off? This image here is a carotid artery. So like Matt was saying, again, you know, this does not mean it's oxygenated blood because it's red. It's just showing the direction of flow. And this is actually an image showing a little bit of plaque in a carotid artery. So that's the kind of thing that we look for in those exams. Pediatric imaging, this is done both cardiac and in general ultrasound. It looks like they're attempting to do some sort of a cardiac ultrasound here with the wrong probe, but generally, you know, stock images, right? Generally, We do things like we'll look for babies who are projectile vomiting. We'll look for pyloric stenosis in them. We'll follow up kidneys in neonates to see if they're blocked, because sometimes we can detect some blockages while they're in utero. We will often do little ones for appendicitis. Appendicitis is a big one. Or if the testicles haven't descended, we'll look for the testicles in the body to see where they are. Matt, what do you typically do for cardiac?
Yeah, so for cardiac imaging, they would look for any holes within the heart. So sometimes babies are born with VSDs, which represents ventricular septal defects, or atrial septal defects, the wall separating the two atria. Then there's fetal scanning as well, and before the baby is born, they can check for any congenital abnormalities. Okay, here's a transesophageal echocardiogram. So not you as a sonographer would put the probe down the patient's throat. That's done by a cardiologist, or what's shown here, an interventional cardiologist. So why do they do this? Well, they can get better pictures. When we scan across the chest, there's a lot of lung artifact, where when the patient takes a breath in, the image goes away, and then when they take a breath out, we get the image. Here with a transesophageal echocardiogram, that bypasses that because it goes through the esophagus and we get much clearer images. We don't have to deal with lung artifact. So in this case, they would be looking for any clots in the left atrial appendage. They would look at the valves more clearly to detect if there's any bacterial vegetations on the valve. You would also use this for inserting a catheter wire through the interatrial septum, where they burn the upper parts of the left atrium if someone were to have an abnormal heart rhythm. So there's a lot of different uses with the transesophageal echocardiogram. It's not only used in the echocardiography lab, it's also used in a whole bunch of parts of the hospital. So you as a sonographer, whether you're in the general or cardiac world, you're not specifically in one room. You're traveling through a bunch of rooms in a bunch of departments within the hospital.
Yeah, and we also participate in biopsies and drainages. So in these pictures, the hands that you're seeing are all physicians. And what we do is we would run the machine on the side and set up the trays for them, the sterile trays. So you'll learn aseptic and sterile technique to help do these sort of procedures in hospital. The picture on the left, the thoracentesis, what they're doing there is we scan the lungs from behind, from the back, and we're looking to see where the fluid is. Sometimes when you get really bad pneumonia or you're post-surgical, like open heart surgery or lung surgery, you can end up with lots of fluid accumulating in the base of the lungs. And it's actually accumulating in the space around the lung. It's not actually inside the part where you breathe air into. So what we'll do is we'll find the deepest pocket. The radiologist will give them a little bit of freezing and then insert a tube and drain that fluid out. Or sometimes they'll be left with the tubes in place until the fluid finishes draining if there's a lot of fluid, and then they're just simply pulled out. And that allows the lungs to re-expand. On the right, we have a liver core biopsy. And in that case, what they're doing is they're just taking a little sample of the liver to send to the lab, looking for cirrhosis or things like that to see how the liver is doing. We do that on the kidneys, we'll do it on the pancreas, you name it. We'll do core biopsies on. So again, you'll just be assisting with putting things on the tray and taking the images on the machine while the doctor holds the probe. As Matt was mentioning, we go all over the hospital. This is a really complicated ICU setup. They're not always like that, but they can be. And navigating your machine through all this mess to get to the patient to do your job, something we will go over with you and teach you some of the skills and what you can do and can't do and touch and not touch. Patient care, that sort of speaks for itself. You'll be, like I said earlier, be responsible for assisting patients with mobility issues, patients who need to go from one department to another, or patients who are just generally unwell, like this gentleman here, who maybe needs you to get him a barf bucket or grab his nurse or take him to the washroom while you're doing his scan. So we'll give you some of those skills as well. It's an interdisciplinary effort, medical imaging where you'll be working, or in cardiology, if you're working at a site that has cardiology or echo separate from ultrasound, you will still be working with lots of people, nurses, doctors. Here we're showing all the different things that happen in X-ray. We have mammography here. We actually have, in Victoria, we have ultrasound techs who actually work right in mammography, taking pictures of breast all day and assisting with biopsies of the breast. We have here an X-ray tech. This is a CT scanner, and on the left we have an MRI. So what's happening in here is that you will often take patients to those guys or patients from those guys. And one of the things that you do as an ultrasound tech is you look at previous imaging, whether it be previous ultrasounds or other imaging like MRIs of the heart or MRIs of the abdomen, CT scans, and you look at any pathology that might be in them. And by doing that, you'll know where to go and what to target when you're doing your ultrasound on that patient. As I touched on before, one of the things that we do deal with quite a bit when we deal with obstetrics is the unhappy side of obstetrics. Typically, you'll see a miscarriage every week. So it's something that we will teach you how to communicate and how to sort of process that kind of thing, and how to be supportive and be there for those patients who are going through a pregnancy loss. Because that is a reality of what we do. We scan so many pregnancies that it happens a lot. And now we got some specialty imaging, not often done, but it can be done. This is a 3D image of the uterus, and it's showing an IUD in place. And over here we have twins. Matt, this is a atrial valve, is it? Or mitral valve? Sorry?
That's a mitral valve. So that's looking at it. If you were going on, like say, that helicopter view of the heart and looking at the mitral valve on face. So here they would look for, again, any bacterial infections, or if there's mitral valve prolapse. That means if one of the valves are floppy, that causes a poor seal, and that would cause regurgitation of blood. So the cardiologist will look at this, and you have to know what they're looking at when they're doing the TEEs. And then the cardiologist would speak with the surgeon whether or not to do a repair or a whole replacement of the valve.
And at the end of each study, we do technical impressions. So this is just showing a paper version of a worksheet that we would do for an 18 to 20 week exam on a fetus. So there's lots and lots of things we look for, both normal and abnormal. So we'll teach you anatomy and pathology so that you can understand what you're looking at and what you need to record. These are just some of the skills that are really go into being a sonographer, and things that you're going to learn. You have to have a good understanding of anatomy. We will teach you the physics of ultrasound. That's a very different type of physics. We'll teach you relational anatomy, ultrasound procedures, and as I mentioned, pathology. Things that are intrinsic to being a good tech are, understanding human behavior, ethics. You'll be taking an ethics course in this program. Communication is essential, and you'll be taking a communication course in this program. Interprofessional practice, as we discussed earlier, is something that you'll also be learning about, how to work with the different healthcare professionals in the environment, and of course, patient care. Some sonographers end up going on into research or other areas, and research plays a role in sonography. Quite often we're asked to be involved in studies at the hospital. So that's ultrasound. So now we'll get into what our program is about. So Camosun College, as a college, is one of the BC's largest, or is BC's largest public college, with 19,000 students and over 1,200 faculty and staff. We teach anything from arts and businesses to university transfer courses. We have dual credit certificates, diplomas, degrees, and post-degree diplomas. So ultrasound is a diploma program. and it is one of the diploma programs in the School of Health and Human Services. So we have 15 different health and human services programs located in that building. Our goal is to educate and support flourishing individuals, families, and communities. And to do that, we teach anything from dental to nursing to practical nursing to healthcare aides, you name it. We probably teach it at our school. And it's in our brand new building, which is lovely. It's $63.8 million investment. It's an award-winning building, and it holds over 800 students. And as you can see here, it's just it's very beautiful inside. We haven't been able to be inside it much this year because of COVID. So we're going to go over the program itself, courses, and we've already talked about the costs. So the people in our program typically range in age from 17 to 55. We do have some people right out of high school, and we have lots of post-secondary students as well. Most are female, although the male contingent is increasing. We have 20% declared Indigenous students. It's important to note that if you identify as Indigenous, that you should tell that to your academic advisor when you're applying, and as well as your Indigenous advisor. Camosun College has Indigenous folks located in the Esquire Center, and they can help you with your application and getting you all the information that you would need, and supports that are available only to Indigenous students. About 20% of our students are supported by the Center for Accessible Learning. It's important to register early with them. And what they do is they support those who may need some extra assistance in the classroom. So it could be a learning disability, or you need some help with a test. The program timeline for Cal students. Yes, so that can be adjusted. It has been adjusted in other programs. Sonography has not started yet, so our first cohort will start in May. You can do it in a longer timeline for sure, but what that means is that because certain courses are prereqs for other courses, it may mean you have to sort of stagger over about 3 years to do it in a sort of a slower fashion. So it definitely can be done. And we have historically high graduation and employment rates for our programs as well in allied health. So allied health consists of the X-ray program, the ultrasound program, and the certified medical laboratory assistant program. Things that will make you successful is good physical fitness and mental acuity. So physical fitness is huge. It's important that you are fit and well. Sonography is really hard on the shoulders, the back, the lower back. There's lots of leaning and stretching, and we're going to teach you how to be ergonomic and how to do best practices to keep you safe. Competence in written and oral English is important, particularly being in Canada. Fluent in computer skills is really good. You're going to want to have good internet, and you're going to want a personal computer. Pretty much everything is submitted now electronically. There will be no paper assignments in your courses. You're going to need good time management. There's a lot of study involved in this school, lots of readings, practice. You'll be practicing every day with your cohort. Financial security is important. We're not saying you shouldn't work, but you'll find you're going to be so busy you may not want to work. So you're going to want to be able to support yourself throughout the program. You're going to want to learn more about the profession, read and talk to people like Matt and myself who are sonographers. So if you have questions, today is a great time to ask them. Enhanced anatomy, knowledge, and spatial reasoning will obviously help you through the course. Spatial reasoning is like if you're good at video games, you're probably going to be okay as a sonographer. There's a lot of hand-eye coordination involved. So our program, it's 24 months of study with no break. So it starts in May, and it'll end in May 2 years later. The terms are 4 months long. There's 6 of them in total. We have classroom activity as well as labs, including simulation. So that means you will be involved with scanning your students, fellow students. So we'll be scanning each other as well as our simulators that we have as well. So we'll go over those a little bit later. Our classes typically run anytime, 5 days a week from 8:30 to 5:30, and you'll be expected to practice about 14 hours a week on top of all of your classwork. And we'll provide the equipment and the time for you guys to do that. So speaking of our simulators, we have 8 of these. We have 4 CAT and 4 Bobs. Bob is our cardiac simulator, and CAT is our obstetrical gynae simulator. So you can see here, she is scanning the dummy here, and with a simulated ultrasound probe, and it produces a simulated ultrasound image and an actual anatomical image on the side. And so that's how we can program these systems to teach you pathology, because typically, you know, when you're scanning each other in lab, you guys are probably reasonably healthy and won't have all the pathology that is needed to be covered. So we can program pathology into these simulators and teach you. So they're really, really cool simulators. We've also got brand new actual ultrasound equipment. So you'll be learning on actual ultrasound equipment. This will be your primary device that you'll be scanning on, provided by GE, and they are top of the line. And it's what they're using right now in the general departments all across Island Health. The program itself, this is the map for the program. So you can see it's pretty intensive. On top of all this, there are 6 credits of electives that are required. I'll go into the elective requirements shortly here. In term 1, you'll be doing all of these courses here. So we're going to get you introduced to patient management and cross-sectional anatomy and how to scan. There's no clinical in term 1. When we get into term 2, we ramp up and start talking about professional communication, ethics, more sonography procedures, and then anything that's called intermediate scanning skills like this, that's clinical. So in term 2, in your first year, you're going to be doing about 4 hours a week on average of clinical skills. When we get into term 3, that goes up to 6 hours a week, and we start introducing cardiac. Term 4, we go on, we learn more cardiac, we start introducing vascular, and you go up to, you're still at 6 hours a week of clinical. Term 5, it goes up to 8 hours a week. And then term 6 is where we get into our final practicum, and then you're out at clinical 4 days a week. So it's important to note, so in our program, the way clinical works is because you're going 1 day a week, it's all going to be in Victoria. It's all going to be local to the college. When we get into our final semester, that is when you will be potentially sent out to a clinical site that could be anywhere on Vancouver Island. So that's going to depend on a couple of things. It's going to depend on the seats available at Island Health. So if they are really short in cardiac, they may not be able to give us a lot of cardiac seats. So we may have to tell students, you know what, I know you really want to do general, but we're going to send you to a cardiac, sorry, we know you really want to do cardiac, but we're going to have to send you to a general practicum. The other thing it depends on too is what you want to do. So you're going to tell us what your preferences are ahead of time. And then what we're going to do is we're going to try and match those preferences as best we can with Island Health and get you a seat somewhere on the island that will support what you want to do. And the way the program works, is set up, is we teach you everything that you need to know. In term 6, you focus on one specialty. So there's 3 specialties in ultrasound. You got vascular, you got cardiac, and you got general. Most people are going to be general or cardiac. So what we're going to do is in term 6, we teach you, we get you to do all the competency assessments and all the things Sonography Canada needs for you to be able to sit and write their exams. And you're going to focus on either cardiac or general or vascular. If you do not get into the one of your choice, which we hope that won't happen, but you know, there is a possibility that could happen, we have the post-degree diploma available. And what that is it's just an additional semester that you can do where you can then come back and do the one either general or cardiac or vascular, whichever one you didn't get that you really wanted to. And some people may do two anyways. They may start in general and then do a cardiac additional semester of cardiac and get both certificates that way, and so that you can scan either cardiac or general, which could be handy if you want to move to somewhere like northern BC or someplace where cardiac and medical imaging are all in one unit. I'll talk about the elective requirements quickly a little bit here. Because you're at risk of injury, we have some requirements that you do electives or have taken courses that qualify as electives previously, that allow you to achieve effective functioning of self. So if you've done, so basically what we've required is that students take courses that are, like 3 of the credits are electives in health or exercise and things like that. And then the other 3 are in courses that are a bit broader and will lend a bit more to sonography. If you contact academic advising, they will actually have lists of all the different types of electives that you can do. If you've done something similar recently in one of your previous programs, if you've got a degree already or what have you, and those courses transfer across to our list of courses, then you may already have credit. You may not even need to take electives at all while you're in our program. So, and you can do them in any term that you want, but you must have 6 credits on record with Camosun before you graduate. And so we teach you some pathology and anatomy, and what we're asking you to do is typically electives and things other than the core courses. As I got into, clinical experience will be at a variety of sites on Vancouver Island. Students can participate in one of those 3 scenarios. There's no guarantee you'll get your preferred site. We will ask you where you would prefer to go on the island, and we'll take that in consideration, absolutely. And it's important to note that not all specialties are offered at all sites. So if you really want to do cardiac, don't tell us you want to go to Port Alberni, because that's not going to happen. They don't do cardiac there. And we'll help you with those decision-making processes. You are responsible for transportation and any costs associated with moving when you end up at a different site. So keep those costs in mind as well. And you'll be there for the whole term. So there won't be any moving back and forth. And then once you're done and graduated, you can go anywhere you want. You know, we belong to Sonography Canada as professionals in Canada. Our Camosun program is done to Sonography Canada standards and will prepare you to write the Sonography Canada certification exams, which will allow you to work anywhere in Canada. Accreditation, we will be accredited with Equal Canada. That takes a bit of time. We will not be formally accredited until we have at least 1 set of graduates, which is typical. We've never had a program at Camosun in our Health and Human Services division that has failed or not met accreditation. So what that means is while you're in the program, you will likely be involved in some accreditation activities, as those would be happening over the next 2 or 3 years. So that's just to let you know that we'll be registered with these guys and we'll be doing some work to get fully accredited. I mentioned earlier the advanced certificate post-diploma. This allows for students who have successfully completed a program to do more and additional certifications. So like I said earlier, you know, if you want to do general ultrasound and you only got your cardiac done while in the program, you've done all the bookwork, you've done everything you need to be able to do just a practicum in cardiac and be done and get that certification, or vascular. It's typically 16 weeks in length because it's a typical semester. And what that means is you'll just go to a site. We'll help you find a site. You go to a site and you'll just do cardiac cases or just do general cases and get yourself ready to do the exams. Oh, something's going on with my computer.
You're not able to advance the slide?
Yeah, can you try and advance the slide, Matt?
Sure. All right. Oh.
Is it working or?
Yeah. So the next one was, oops. Well, sorry about that, guys. So you talked about the advanced certificate, post-graduation. This is the one that was next.
Yeah, it should be slide 46 is next.
46, and you're not seeing that on your screen?
No, I'm not. So it must be my computer that's acting up.
I can take over. So yeah, for post-graduation, there's a few points to look for. You want to be affiliated with Sonography Canada. Once you graduate, you'll be eligible to work in all the provinces. So perhaps maybe you have some family out east in PEI. You can work in PEI. If you want to know what it's like in Ontario, you can work in Ontario. So you can work across Canada. Not mentioned here, you can apply to write the ARDMS exam. That stands for American Registry Diagnostic Medical Sonographers. And then that gives you the chance, if you want to work in the States, maybe if you want to move down to California, it's possible. Most technologists will find casual work. So I know from experience in the cardiac ultrasound lab, they're always hustling and trying to get casual techs out there. In the general ultrasound department, same sort of thing. With this link here, you can see the pay scale for sonographers. So when I started, it was about $29 per hour. That's bumped up to about $32 an hour, I believe. And that's only been about 6 or 7 years. And there's ongoing opportunities if you want to go up another level after sonography. There's education, you can start teaching. There's management opportunities like Dustin has. And you can also go into the vendors such as equipment sales and applications. So you work for General Electric or Philips. So sonographer jobs futures, or excuse me, future sonographer's job future. So there is a high growth rate in the amount of jobs opening for sonographers. I can already tell you from experience here on the island, as soon as I came here, they opened up, I think, 2 or 3 additional cardiac ultrasound labs, one in Saanich Peninsula, one in Duncan. They opened up more spots in Campbell River. So the opportunities just keep rising for the amount of ultrasound work on the island. As more seniors come over here, there'll be definitely more demand for ultrasound. Again, so more helpful websites. Check out all of our Camosun College sites there. If you want to learn more about sonography, go to Sonography Canada or go on YouTube, what a sonographer does, the different types of roles a sonographer would do in their day. You can look at the current pay rate with the Health Sciences Association with BC. And as we just went over the graphs, the amount of prospects for jobs. Okay, so I think we covered, did we cover services for students at Camosun?
Not yet. Now my computer seems to be working. So these are all the different services that are available at Camosun. We've talked a little bit about CAL. We've talked a little bit about Indigenous support. There's also counseling. There's financial aid and awards. There's also academic upgrading. So Mary can help point you in the right direction with those folks and get you your equivalency or your high school equivalencies upgraded to be within the last 5 years. The Writing Center can help you with reports and referencing and all sorts of things like that. Academic advising, they're the ones that would help you pick which which electives you have that qualify or which electives you might need. Fitness and recreation, you have access to the gyms at the school, and there's childcare. So if you have children, you may qualify for childcare. There's all sorts of things that you can do to get connected at Camosun College. So we'll just briefly talk about financial aid. Catherine could not be here today, so what she would normally tell us to do is to get an account set up right away for your financial aid. It can be a 6-week process just to get in the door. So don't wait for your financial aid application don't wait to do it until like right before the program starts, because you won't have your money in time to get registered. They do part-time loans and grants. Again, you can apply for those through financial aid at Camosun College. It's a six-week process, so again, you want to do that as early as possible. And they're great. All you have to do is email them, contact them, and they'll tell you all the different part-time, full-time ones that you may apply to. Our program is full-time, so if you are a student doing it in the full-time manner, meaning you don't have some sort of academic accommodation, and because we don't do it part-time unless you have one of those, you would only be applying for full-time loans. There's also bursaries that you may qualify for. The application period for those is typically September and January, so before twice a year that you can do that. And there's bursaries up to $1,500 available. The Esqualin Center, they have some funding that's available for First Nation students, so definitely check out that if you identify as Indigenous. There's tuition waivers for those who may have been former youth in care with the government. And there's also the Ike Barber Transfer Scholarship. Doesn't really apply to our program. It's more for the nursing folks, those who are moving from Camosun and then finishing a degree somewhere else. And our program, you're not actually able to do that. This is a little bit more information about financial aid. This is showing when you would apply for them. We actually have our own student awards in our Allied Health and Technologies department. There's one per program per year, $500 that's available to students. It's typically non-academic in nature. It's just like someone who persevered, someone who did really well. And we all get the students who nominate each other and staff nominate students. So it's a really good opportunity to get some additional monies without having it tied to academic performance. On top of that, we actually have graduate awards. So there's a total of $3,000 awarded to graduates achieving the first and second highest GPA in their academic program courses. So at the end of this 2 years, the top 2 people in SONO will get $1,500. There's a citizenship award for $1,500 as well. Capstone awards. Capstone is a project that you'll do at the very end that helps tie everything together that you've learned. And it's sort of like doing a thesis in a way. And those who get voted as having the best capstone award can get another $1,500. So there's quite a bit of extra money that's actually available to students just through going through our program. And that's really it. That we've covered everything today. I know it's a long presentation, so apologies for that. What I'll do is I'll just open the floor to questions. If anyone has turned the mic on and want to ask a question, or you can type it in the box and we'll do our best to answer them for you. I'm just going to advance our slide to the very end here. There we go. So yeah, if there's no questions, you may think of something later. Participating in this, as you have, is one of the requirements for this program. So if you go to the online version, or if you just want to scan this QR code here, you can just click this link. It takes you to a SurveyMonkey survey, and you answer some really easy questions. It proves that you came to one of our sessions, and that's just logged in our system. So you only have to do this once, and it's good for many years. So do that. If you have any further questions for any of us, where did it go here? There we go. Our emails are here, and they can be found on the website as well. And absolutely, you can email myself or Matthew anytime, Sharon. All right. I'd like to thank everybody for coming today. There were lots of good questions in the sidebar as we progressed through. It is a long one to sit through, particularly if you were keen and sat through the MRAD one earlier today. We do share a lot of the same coursework. So if you end up in X-ray and you do a lot of their courses, and then you're applying to SONO, hoping you get into SONO one of these tries, those courses that you did in X-ray, you can transfer into SONO and a lot of the courses will carry through. So it won't all be for naught.
Yeah, you have a smaller workload if you were to do X-ray and ultrasound, and that just makes you more marketable in the healthcare industry.
Absolutely. So we'll thank everybody for your time today. Like I said, you can email any of us. Our presentations are available on the front page of our webpage on the camosun.ca website for sonography. So if you need to click any links or do anything like that, feel free to go back there and email us anytime. Thanks, everyone. Bye-bye.
Thanks. Have a good afternoon, guys. Bye-bye.